you already have been down the road a little bit.
Yeah, I know lymphedema.
Yeah. Looks like you managed it pretty well.
Yeah, I was going through my photos on my phone, and I had a picture from August 2018 when I was diagnosed with it, and I had my hands out. I was like, oh yeah, it was a lot tougher then.
Yeah, it looks like you managed it real well. Well,
So
we can.
I can grab some more.
Like, is there anything
More
else I should be
information.
doing, or-
Exactly.
Yeah, exactly. Yeah.
So, we can,
Any questions you have, anything you all want to get out of this, let's customize it, make it. But these are just the materials that we already had. So if we look at that first page, it's the healing power of knowledge. And I guess the biggest thing, and it seems like you're both very aware of this, that prevention is the biggest thing. So if you can keep lymphedema in stage 0 or 1, 0 being subclinical, meaning it's not anything we could measure or identify, or 1, just a minimal amount. And I would say that's probably where you are, because even though you might have been larger at one point, you've been able to get it down to a minimal amount.
Yeah, I think I caught it fast enough, because I thought it was something else. Might have been cording or something else going on, because I was doing my chemo at the time.
And just post-surgical fluid retention and chemo, you have all those other things going on. When I started doing this 18 years ago, a lot of the people that we saw, their surgeries were more invasive. They weren't doing sentinel nodes, taking out a lot more, just the surgery, everything was so much more intense. And there wasn't awareness. There wasn't this concept of prevention or catching it early. There wasn't this kind of concept of it being reversible. Everyone we said, oh yes, you're wearing this forever, and you have to do this forever, and we were catching it so late. Physicians, referrals, that consultation, that the outcomes were just not as good. So I'd say one of the most exciting things in the last 10, 12 years is getting people immediate and before. So you can get the education piece in, you can do the monitoring, you can, one of our own therapists was diagnosed, had several nodes out, and she definitely had some significant edema, but catching it early, and she'll still wear her sleeve when she plays tennis and things like this, but she's back to doing all the things and has no regular issues. But because she's kind of in that stage 0, 1, it will come on, and then she captures it and controls it and maintains it. She can keep it kind of in that subclinical realm, which is pretty awesome. It's a lot more rewarding to treat something that you're keeping control over instead of coming in when things are out of control. And then it's a really long-term management. I am very much a physical therapist for the clinical care side, for that person, that caring side, that just that quality of life side. But one study that came out a couple of years ago was more based on the financial side of lymphedema. But if you think about this research, when I talk about it, if you spend more money in healthcare, that means you have more health problems typically, right?
yeah.
So this study came out that people who had early intervention for lymphedema spend a lot less money in healthcare related to their lymphedema than people who didn't. So if you let it get out of hand, it's a lot more time / money in that services, whether you need more products, you need more care. But catching it early was actually even proven to require less health care later. So
Time is money too, right? So you're really work to have appointments to, take care of
and
them
that's
and all of that, so it's all part of that.
it's not, and just your quality of life too, but it's not even getting into what may be costing you money or resources in other ways. That was just really looking at how much money was spent in healthcare for people who captured this early or prevented it versus those people who actually had a pretty more involved situation. So one thing that's recommended kind of early on, don't know how far out you are, but you mentioned that you're a little bit earlier in this whole, having lymph nodes removed and being aware of lymphedema and monitoring, keeping a really close eye, catching it as early as possible. For some people, I have some patients that will come and get measured once a year or every 6 months initially, just to make sure that if a centimeter is not very much, right? And if you increase the centimeter, it might be hard to catch. I've had even some people who they gained weight or lost weight, and they kind of want to keep a base. One of the most important things is just getting a really idea of what your arm looks like, so you can really keep an eye on it and be aware, kind of capture that early. So a lot of times I'll mention to people, it's one thing to compare arm to arm. It's another thing to become familiar if you have certain grooves around certain muscles, or you can see certain bones around your wrist or in your hand. You can really identify that you have certain creases and certain grooves, because as you early edema, you start to just lose some of that. So it might not even get picked up with a tape measure, right? You just kind of have a loss of definition, and picking up on that definition early is really important.
I would tell people, well, this is my old looking hand and this is my young looking See, it got rid of the wrinkles.
Yeah, exactly. You do get excited at our treatment. We're like, oh, you have wrinkles. And we're like, I've never thought I'd get excited about wrinkles, but we do. We get excited about wrinkles. But you're right. It does, it might look a little more youthful, but that might not be a good thing.
It wasn't a good thing, but.
It can be really hard too, depending on comparing just arm to arm. And that might be a time that having some measurements might be useful. An example I have of that, I had, back to tennis again, but I had this patient a long time ago, and she played 5 days a week, which we're talking 10 hours. And she's right-handed, and her issues were on her right side. Her right arm was nothing like her left arm, so she couldn't go by looking at size as much. I mean, yes, she had muscle definition, but her shirts were tighter on this side and looser on this side, and that might be for some people kind of an alarming thing, but for her, it was just because of her activity. It was going to be harder to pick up on if she started to get a little bulkier on one side due to edema versus muscle. So these are times where you might really need to have some measurements to make sure. We do track weight a lot too when we're taking measurements. We definitely have people come in. I want to compare you to your measurements a couple years ago, but I've had people lose 20 pounds, gain 30 pounds, and that makes a big difference. So just to try to help us assess what the changes in measurements are related to. So on some of these sheets like this Healing Power, we talked about the stages, so you kind of have that in there. The incidence, it usually occurs in 0 to 3 years, and I would definitely say I usually see it in the first 6 months or a year. The only time I've seen it happen very far out was related to an accident where someone fell and fractured her arm on that involved side. And that was 10 years out. And I saw her acutely, so I don't know how she ended up later, if that was reversible or not. Because I went and saw her in the hospital, so it was very acute. But I can say based off experience as well as research that it is less common. And then, of course, if you haven't had lymph node removal in any type of way, and you haven't had any radiation, you're not really at risk. So, or unless you've had any damage. Other surgeries can cause damage to lymph vessels. So, but those would be the individuals that would be more at risk. So,
I have a question, if you don't mind. We have a client whose tumor has actually grown like outside of the body, and the positioner is actually pushing on the surgery, no lymph node removal, but I think the pushing on the nodes has maybe caused lymphedema because her arm is significantly larger than the hand. Would therapy for that be beneficial for her at all, or is
it depends. If you have active cancer, you have to be much more conservative about your treatments. So if there's no active cancer, I would definitely, what can we do to minimize the fluid from gaining? Right. We need to understand where is that active cancer, because you wouldn't want to be doing any manual stimulation over any cancer cells, because you wouldn't want to disrupt them and move them farther along. So, but definitely trying to, let's say they're 15% larger than normal. If you can find a way to maintain that, such as just wearing a garment just so you don't progress any farther, I think that would be important. But active cancers, I'd want to work with the physicians and make sure we're doing things that work together and collaborate to try to give them the safest and best care. So I would say preventing further enlargement is really important. So some other information in some of these handouts. So any questions you have, please let me know. Talked about prevention being the best and easiest way, and keeping a healthy weight is really important for a couple things. One is having a healthy BMI. People who have elevated BMIs have a higher risk of having lymphedema. But another thing in that is that people who are have better BMIs probably exercise a little bit more, and exercise is associated in a positive way in a post-cancer treatment. As far as strengthening is beneficial for lymphedema, and we'll get into that a little bit more in a moment, but also having regular cardio exercise is better for outcomes following cancer treatment. It's better for treatment of fatigue. It's just kind of a win-win, and there really are not adverse reactions out of all the research studies. There aren't adverse reactions. I mean, if you're actively going through cancer treatment and your fatigue is interfering with your function and the exercise makes that worse, then that's going too far. But it really shouldn't be. And exercise is just a really important part. And y'all are through cancer care as far as I know right now, but anyone getting started, as soon as you can get started and make that exercise a part of your routine.
So that's like one of my questions and concerns, because I have tried to do a lot more exercise, and so yoga is one of my go-to exercises. I'm always so scared that I'm gonna overstretch or do something, push myself that would cause lymphedema. So what you're saying is it's not going to, but there was one woman I talked to, and her lymphedema was a year later, and she was doing some kind of garden activity, and she injured herself, and that's, so I'm always so cautious on what's good for my body if I'm doing something that I feel stretching, especially the arm, the vines and stuff like that. I'm just
Yeah, it is important to not get into that fear mode, because that's not healthy on many levels. And so, but the biggest piece of advice is listen to your body and start small and build up. So if you have some arm behind your back twisting, maybe do modified versions. Keep an eye on these, on your definition, on your detail, on your girth. And if ever you wanted to get some baseline measurements and then start activities and then reassess just to make sure. But once again, keeping track of that weight as well. Because if you're starting new activities and you lost 5 or 10 pounds, that might have an effect. Or if you started, one of your activities might have been, I'm going to start lifting weights with my arms. That also may affect your girth, so we need to kind of balance. Those measurements go up because you've been doing bicep curls and forearm strengthening. But start small, listen to your body, pay attention to details, and then build up. Because moderate exercise, moderate cardio, moderate strengthening is beneficial. Okay? And the nice thing about yoga is you're getting flexibility, and you're getting stretching, and you're getting strengthening. So it's just depending on
I've been in some classes where I'm like, this is not relaxing.
That's true.
Sessions.
That is true. Let's see if there's anything else that hit all those points. Do y'all want to
Now,
hear?
the infection, because they told me that I had to be careful about it. Mosquito bites, or didn't get any kind of cuts.
Sunburns, any of that.
Nothing on that side. You have to really.
Yeah, so I've had, patients that came back who gardening was really important to them, and then just come all scratched up because they decided to prune their roses and things like that. So, yeah, prevention, once again, is our biggest, easiest, best thing we can do. And yes, so being careful about not cutting cuticles and not getting scratches is really important. The function of those lymph nodes were to detect any infection and to fight that infection, and that could be somewhat reduced, as well as you don't want to be bringing edema or any infection into that area because the risk of cellulitis is greater. And just monitor it, prevent it. If you get anything, treat it. The other thing is breathe and don't panic either, but do your best to try to be preventive. I have looked, they do make gardening gloves with extra on, so you can avoid the scratches from the
long
roses.
sleeves. I mean, I don't have that, but I have had poison ivy so bad. Like if it brushes up against me, my whole body is just like.
I'm the same way. Like I've got it in the air many times to where
Yes.
I can't open my eyes.
So I'm always, when I'm out there, I'm in long sleeves.
Absolutely. And just make sure you know what those leaves look
But
like.
every time I get it, I'm like, where did I get this from?
Yeah. So, did that answer that well enough about the infection? Another thing is like not getting overheated, so not being in hot tubs for a long time. And what I'll tell people, like, I can't get in a hot tub, and I'm like,
What about hot yoga? See, that was another thing. I asked my oncologist about that, and she said that there was not enough research. to
there's
show.
not. How hot is a hot yoga room? Like 95?
I don't know. It's not my favorite thing, so.
Gosh darn you. You can use that as an excuse if you want.
I did try it once, and I didn't get lymphedema for it, but it was like, it was on my list, like, oh wow, like I can't do that, or.
Yeah, I wouldn't. I agree. There's not research about that, and medicine is. We're practicing medicine. We learn new things. It's changing always, and we're trying to stay on top of everything. But right now, the recommendation, like not, to avoid prolonged use of hot tubs. So what I'll tell people, well, really, I'm going on this trip, and there's this hot tub, and the nice thing with the risk of upper extremity lymphedema, you can throw that arm outside that hot water and enjoy your hot tub, right? People with the risk of lower extremity lymphedema don't quite have that same benefit. But the same thing with infections. If you had cuts or bug bites or anything that might be open skin, I would avoid that type of thing until it were healed and not increase that risk of infection.
How does the mechanism of, like, for the hot tub or the overheating, how does that work? Like, I get, like, if you get a cut or a mosquito bite and the body's sending that fluid down to kind of clean that out and then get stuck and trapped wherever. But what about?
If you're increasing circulation, you could be increasing some edema.
I see. Okay, that's interesting.
So, and you really do want to, as far as the infection goes, I definitely have had people who have gotten cellulitis.
Is that a staph infection?
It
Because
could
my
be.
surgeon really scared me one time. I saw her like a year after my surgery, and she said, "I'm so sorry you got lymphedema after I removed those lymph nodes." And she said, she had a patient that actually got a staph infection. It's like, okay, do I need to freak out about this now because I'm a sewer and I hit myself with pins all the time?
Yeah. So, I mean, staph is just a bacteria that's all over our world, and it's a common type of infection. Cellulitis doesn't mean it is a staph infection, but it often will be. But cellulitis is more just an infection of the tissue.
Okay.
It's red, it's hot, it's painful. Lymphedema is not painful. when I say that, it may be uncomfortable, it may be heavy, it may be achy, it may be maybe some light pain depending, or lower pain depending on who interprets it. But if I have a patient, and this actually happened not too long ago, who comes in and says, I'm 7 out of 10 pain and my lymphedema is killing me, you're going to the doctor. We need to rule out blood clots, we need to rule out cellulitis and infection. Those things don't fit. Okay. So it's not a high pain, it's a heaviness, it's an achiness, it's a discomfort. So I think that's real important to know too. But redness, heat, and sudden changes like that. So, we can't get into what the treatments are like. You've been through some treatment. You're doing your best to avoid treatment. So,
Again, proactive treatment.
yeah. And I don't know if you want to do a little bit for your Facebook Live as what treatment might involve.
Yeah,
Might
absolutely,
involve.
that'd be great.
Okay.
And Facebook Live, if you have any questions out there, feel free to post them. Do you mind checking around on that? Okay, and we'll get your questions answered as well.
All right, so this is for our community at large as far as some education on lymphedema treatment. It can be, well, first of all, it should be customized for the individual, because if someone has a very acute minimal problem, that would be much different than someone has a very long-term or chronic or irreversible problem. I'm just going to show you a few. I won't get into too many details unless someone has specific questions. One of the first things we do is education, and there's something called MLD, or manual lymphatic drainage, and we do that as physical therapists, but then we are trying to educate our patients to do some similar type techniques to maximize that lymphatic flow. We often start more proximal, near the body, and start over the healthy side, moving fluid towards the healthy side, and then we work down the affected limb, and then we come back up. We include some stimulation of lymph nodes, trying to help move fluid through those nodes while we're doing this. One of the techniques that, there's a technique called brushing that can be, has been proven to be effective, and that's something that the patients can, or may not be a patient, that people can do at home for themselves. This is one that we have modified and started using because we think it's has a similar effectiveness to brushing, but these, yes, it is a dishwashing glove, but you can, but the nice thing is you can clean it. Some people might use it in the shower, and so, but you can see that this kind of tugs on the skin in a very light, superficial way, but this is where our initial lymphatics, this is kind of how it affects them, and it helps get those proteins, those larger molecules, into that initial lymphatic system. So we would follow that same, we would start on the, this is now my, because this is a left glove, so I've changed affected sides, but I would start on my healthy side, and then I would move down. And so we teach our patients how they can help themselves on a daily basis, trying to stimulate those lymphatics. So if we just simply tried to reduce some of that edema here and the patient walked out, we would lose a lot of change because it's just going to fill back up. So our thing is we want to stimulate and reduce the size, maintain them until the next visit, and then keep continuing down until we get them hopefully as small as their unaffected side, or to get them as small as we can, and then try to get them on some long-term options. Typically we're talking about compression garments, sleeves. Sometimes that alone isn't enough. Sometimes people end up with compression pumps and or some other type things. So if kind of a long-term traditional thing that we've done. Kara, would you mind?
No, absolutely.
Being a patient?
I'll be the patient.
So if Kara had been coming for therapy and we had done some of our lymph drainage, possibly some pumping, I would This is more traditional. We do some other things now which are much nicer for the patient, but I would do a layer of foam, which I'm not going to do here simply for brevity. But we would do this. It looks like an ace bandage. It is not. And we would do a series of this wrapping over foam, and it would continue up like this. So this is a short stretch bandage. If I had an ace wrap, it's going to stretch, stretch, stretch. And if she starts to swell, it's just going to allow her to swell. This is going to maintain her at that reduced level that we worked on today, trying to get everything down. So I will tell you, this is not such a fun thing to have to do because it's tedious and they come unwrapped. But it is a temporary method for us getting some customized compression to help us maintain what we achieved today, so next time we can achieve new results and we can get some cumulative outcomes.
I actually have probably pictures from when I actually went through this treatment that I can share on that event page so you can see what that really looks like. But it's
and we do have some on our website, Bodies in Balance PT, or livewellpt.com. We have some as well. I don't have, so if we have some newer ways. I actually have more of a leg. Do you want to sit in here and I'll show you this? I didn't have an arm piece here because we actually order them for individuals. We don't keep them in stock. So people do get lymphedema of their leg, so it would be a very similar thing for your arm. So this is in place of the wrapping that I just showed you. What's nice about this, it doesn't come off, it doesn't unravel. You want to take a shower, wash your hands, any of that, and then you can just put it back on. So our quality of life has gone up, our frustrations have gone down, and the expense isn't really more, and that's really nice.
Yeah.
And some people just think this is really effective and different than maybe a compression wrap, and sometimes they'll use it interchangeably. So this is just really easy. So once again, I would be on the skin. And you know how Velcro is really great and really bad at the same time. And I did not set this up ahead of time, as you can tell. So this is just kind of a, should have put you on the black side, that's what it's set up for. So you can customize this to the individual. But you get the idea. So it would be an arm piece that would go here, and then you can adjust the tension, and so you can add pieces for the foot, of course, but you can get pieces for the hand and for the arm and adjust the tension. And then the nice thing that's going to help you maintain in between sessions until you can get the arm down to where you're ready to measure for a garment. And then there's a lot of things that go into making those decisions if someone needs a compression garment, what you do. And so this is just where that individualized custom treatment comes in. There's a lot. There's some for prevention, which are very light and stretchy, and you can see this thing's just it's gonna feel pretty good when you put it on, right? I think this is what you have. It's a 2001. If you want to get a feel for that. So it's soft. It's soft.
It's a little bit more comfortable than Spanx.
Yeah, a little bit more comfortable than Spanx. Yes. But this is going to be for low level. It's going to be maybe even for preventative. Got that person wants to play tennis, or they want to do some other things and they're just a little tentative. So this is a little more of a preventative level, or very light. We're back in that class 1, class 0 subclinical level. And then sometimes you get people that have, you may have heard some of the terms like fibrosis. They're a little bit larger, they're not really getting that full reduction, some of that proteins in that tissue. Fibrosis is just a little more hardened area, and so then we may move up into something that's just a little stronger. So It still moves a little bit this way, but it's not moving.
Yeah.
It may move in length this way, but it's not moving out. It's a little bit thicker. Not a lot, but it's not quite as soft, but it's just a little bit more rigid. It's a stronger containment. The other one was a lighter containment. So you might hear about pressures of 20 to 30. That'd be more of a class 1 versus a class 2, like a 30-40, something a little bit stronger. And then sometimes people end up going with a custom garment, which sometimes is also called a flat knit garment. And so I brought an example of this. So it's flat knit because it's actually made for the individual. You'll see the seam. So you actually measure multiple points all the way up, and then you can even customize it if people have certain issues. This has a piece of silk in the elbow, so there's less abrasion there. And you'll see the thickness and the rigidity of this fabric has gone up even more. And that's more in the custom realm. And then we get into gloves and gauntlets. A gauntlet is something where you get compression over the hand and would overlap slightly with the compression sleeve. That's a big thing. If you go to a compression garment, some of the time people need something for the hand, and sometimes they don't. But really making sure as you go to a garment that you're not getting any increase in girth in the hand. So just communicating with your physical therapist to help you make the right choices, because the choices are endless. They are growing really fast. So a few other things that we'll use. Once again, this is for a focus someone's using our arm. This is a caricia. So this has a bunch of little foam chips. So if someone starts to get some fibrosis and it's a hardening of that tissue, you can put this on, and you can either get them to where they're custom and have a little compression. Sometimes we'll use them under the pump, but those little foam pieces help break up that hardening in the tissue. Once again, that's for a foot, but you get an idea of what it would feel like if it were made for your arm. And so when you put that on, some people sleep with them. Sometimes we'll use them during the day. Some people just choose to put it on while they read or watch TV. And then when you take it off, it's actually dimpled where it started to break up that hardening. So it just helps reduce that. Sometimes we use, I think probably all have seen kinesio tape out there. A lot of sporting, a lot of different sports will use them. Runners on their calves and volleyball players on their shoulders. You'll see swimmers with tape on their back and on their knees. So I really like, if I have someone with some temporary hand swelling, when I say temporary, it's brand new. We don't know where we're going. This is a quick and easy. They can walk out with it on their hand. And so we just cut it based on where we want to use it. This is stretchy. And so that little stretchiness, when you put it on, it just adds enough compression to try to help reduce the fluid. We also use this punch tape. Punch tape is pretty much the same type of tape, but with holes in it. Supposedly, once again, I think the research hasn't been done, but kind of using knowledge of physics and then combine that with some experience, it seems to be pretty effective with getting some multi-directional type reduction in swelling. So
I've used that personally, and I'm a huge fan of it. It's made quite a difference for me. I like it.
So once again, someone comes out with this, it takes a long time to get research, but you base it on experience, and the big thing with it, there's no harm, right? Unless you like put in a tourniquet around your arm and sit you down. I don't think there's any harm in using this. So those are some of the ways we try to be creative and try to maximize quality of life and maximize outcomes. But we also need to find someone who has that experience and knowledge but is able to customize something for your needs. Because prevention has different needs than people with some long-term chronic issues. So I think that's the main thing as far as treatment. I didn't go into the compression pump too much.
We hope not to get to that stage.
Yeah, we don't have to. This is just one other modality that some people who need kind of a multimodal approach to
Thanks for
treatment,
joining us. If you have any questions, let us know.